Hi everyone, my name is Na with Parkwood Home Care, and I'm here to give a little talk about communication barriers. So in caregiving, there's a way that caregivers should communicate with their clients as well as the family of their clients, and I'm here to highlight some things that become a barrier in communication between caregiver clients, family. So interrupting. Caregivers have to learn not to interrupt when the clients are speaking, learn not to jump to conclusion, and having some impatience with the speaker. It's always important to make sure that you're patiently listening to the speaker, who is also the client or client's family. Sometimes when you're talking to someone, you might get bored of listening and you want to quickly change the subject. It's very important to know that all these fall under interrupting, and then you have to eliminate that for good communication. Answering own questions. When you do ask the client a question, make sure that you leave the question open-ended. Don't answer a question by yourself, like, how was your night? Was it good? Like, how was your night? Good? Just leave the question open. That way they can give you an answer and you're not just like not engaging but engaging with the client. Also, giving advice. It's very important to make sure that you're not giving unwarranted advice to clients, because that would be overstepping a boundary. It is important to, for instance, if a client has a question about finances or savings or what their diet should look like they're talking about their diet, it's not in a position to say, oh, I think you should be on this diet, or I think you should do this instead, I think you should invest in this, invest in that. Generally, giving them advice is a communication barrier, because then there's there can be conflict of interest. Also, minimizing their problems. When a client is talking about their problems, talking about their pain, talking about their family, it is important to make sure that we're not answering them in ways that minimizes what they're talking about. For instance, oh, I'm in a lot of pain today. Oh, your pain is not that bad. Or saying something is not too bad when they're clearly expressing how it makes them feel. That's also a communication barrier. Also, patronizing comments. It's important to not baby talk your client, like good boy or good girl, or just like those gibberish that we talk with when we are handling babies, because these are full-grown adults, and it's important to make sure that we are not patronizing them and you are speaking to them with respect as the adults that they are. Also, failing to listen. Sometimes we're talking to our friends and then we zone out. We are looking at them and pretending to listen, but we're not listening. It's important to be actively listening to your clients, and the way to promote this is to make sure you're paraphrasing, like maybe repeat the last sentence that they said. Oh, when I went home, the weather wasn't too good. Like, oh really, the weather wasn't too good? Just kind of going back into what they're saying to make sure that you are actively listening, and that way you promote the communication between yourself and your clients, or yourself and the client's family. Thank you. That's all I have for you today. Bye.